Good day, ma'am, and to each and everyone. So my name is Eliza Ferris from BSN 1A of Iloilo Doctors College. And for today, I'm going to perform a term demonstration in regards of assessing the anterior chest. So prior to performing this procedure, we need to, of course, perform hand washing or hand hygiene and then our PPE if there's a necessary. So I have here an alcohol. This serves as my sanitizer. Okay. So the next thing that we're going to do is to prepare all the equipment needed for the assessment, and then we're going to proceed for the assessment proper. Hi there, sir. Good day. How are you doing?
I'm fine.
Okay, that's great to hear. So by the way, my name is Eliza Ferris, and I'm your student nurse for today. So can you kindly confirm to me your name as well as your date of birth?
Bernie N. Cofreros, August 19, 1966.
Okay, thank you. I think we're good in here. So, the first thing we're going to do is to identify our patient. So, this is to ensure that we have the right patient in front of us. So, it is also important for us to establish rapport and introduce ourselves towards our patient. So, if there's any doors or curtains within the area, we need to close them in order for us to provide privacy to our patient. So, the next thing that we're going to do here is to explain the procedure to our patient. Okay, so, sir, I'm here to perform the assessment of your anterior chest. So why do we have to do this? So this is to ensure that everything is normal. So if there's any abnormalities in your anterior chest, so we just like any discoloration, swelling, if there's any lesions or any signs of respiratory implications, so we need to take note of them in order for us to prevent further complications. So do you have any questions with that or any clarifications?
No.
Okay, so if there's none, we're going to proceed then. So don't worry if you do have any questions all throughout the assessment, you have the freedom to do so, okay? Alright. So the next thing that we're going to do is to proceed to the first procedure, which is what we call inspection. So what are we going to inspect here? Okay, so we are going to inspect the anterior chest of our patient. But before that, we are going to ask our patient to remove his clothes. Okay, sir, can you please remove your clothes so that I can check your anterior chest? Okay, let me help you with that. Okay. So as I'm inspecting here the chest of my patient, he has a light to deep brown, which indicates that is a normal color. So if there's any pallor, it may indicate anemia. If there is a bluish, it may indicate cyanosis or result from hypoxia. So if there is any redness, it may cause allergic reaction or indicate allergic reaction. So the next thing we're going to do is to inspect for the level of the clavicles, sternum, as well as the costal angle. So here, as I'm inspecting my patient's sternum, it is positioned at the midline and it has a straight level, which is good. So in terms of the level of the clavicle, they are located in a good position, which is good. So the next thing we're going to check here and observe is for the costal angle of our patient here. So as I am inspecting here, they are positioned at the less than of 90 degrees. Which is good, and the ribs are inserted into the spine, okay, which is good. So the abnormal indication for the sternum or level of sternum, if we can see here that the sternum is sunken and it has adjacent cartilage, it may indicate pectus excavatus. So if there is a forward protrusion of sternum, it may indicate pectus carnatum. So in the costal, the abnormal indication on the costal angle, if we can see the widened costal angle, so it indicates COPD. So the next thing we're going to check here is for the shape of the chest of our patient. Okay, sir, I'm going to check it here. So can you please move a little bit aside? All right. Okay. So by inspecting here my patient's shape of the chest, the anterior posterior diameter is less than to the transverse diameter. So the ratio of transverse diameter is 1:2. So it indicates that it is a normal finding. So So if we can see that the anterior-posterior diameter is equal to the transverse diameter, it may indicate or lead to barrel chest. So the next thing we're going to check here is for the respiratory quality and pattern of respiration. So here it includes the rhythm as well as the rate. So here, okay, sir, maybe sit straight. Put your hands at the side. Alright, so as I'm inspecting my patient, the respirations are relaxed, quiet, and effortless. And also, it has a regular rhythm and it has a normal depth. So, which is good. So if we can see if there is any labored or noisy, it may usually seen on those person who have severe asthma or chronic bronchitis disease. So the next thing that we're going to inspect here is for the intercostal spaces for bulging or retraction. Okay, so here we can see here that the intercostal are located here. So far there are no retraction or bulging of intercostal spaces, which is good. So if we can see here retraction of the intercostal spaces, it is usually increased in inspiration effort. So we need to take note of that abnormality. So the next thing that we're going to inspect here is for the use of accessory muscles for respiration. Okay, so as I'm inspecting here, my patient has the use of accessories cannot be seen with the normal respiratory effort. Alright. So the next thing that we're going to do is to proceed with the other procedure, which is what we call palpation. So here we are going to palpate the tactile firmitus of our patient. Okay, so I'm going to palpate it here. Okay, so the firmitus is symmetric and easily identified in the upper regions of the lungs of our patient. So remember, if we are going to test, if we are having a female patient, we are going to avoid palpate the breast area. So the next thing that we're going to check here is for the tenderness, sensation, and crepitus as well as masses and lesions. Okay. So, Sir Bernie, I'm going to palpate here. You're going to tell me if you can feel any hurt or any tenderness. Pain. Okay, do you feel any hurt?
No.
Okay, so there are no tenderness or pain is palpated over the lung area with respiration. And there are no also crepitus that is palpated. And usually the surface of the chest of my patient doesn't have unusual surface of masses or lesions. So if there is any unequal, if we can palpate here the patient with crepitus, so usually it can be seen of those persons with lung disease. So if there's any masses or lesions, it can indicate a cyst or tumor. So next thing we're going to palpate here is to determine the anterior chest and excursion or expansion of the chest of our patient. So, Sir, Sir Bernie, I'm going to palpate here. Alright, so you're going to have a deep breath for me, please. Inhale, and then another inhale. Exhale. Last one, inhale, and exhale. Okay, thank you. So as I'm observing here, my thumbs move outward in a symmetric and in the symmetric way from the midline, which is a good finding. So if there's an equal of chest expansion that occur, it can usually occur on those person with severe pneumonia or chest trauma. So if there is any decrease on the chest excursion, so the basis can be seen here on the lung of our patient if there are COPD, if it is diagnosed with COPD. So next is we're going to proceed with the percussion. So here we are going to check for the tone at a pieces above clavicle and then intercostal spaces. So we are going to comparing it bilaterally. So by doing the percussion, we are going to ask our patient to sit still again here, and then we're gonna set a straight head. Okay. So I'm going to percuss here the areas. Okay, so far as I'm percussing my patient's anterior chest, the resonance now sound can be heard on the lung tissue and the tympani sound over the stomach here as I percussed it earlier, and the flatness is detected on the muscles and the bones of our patient here as I percussed it earlier, and then the dullness over the breast tissues, liver, and heart. So the next thing that we're going to do is to do auscultation. So here we'll be needing our stethoscope. So what are we going to auscultate? So we are going to auscultate the anterior breath sounds and adventitious breath sound. Okay, so I'm going to check it here. So just breathe normally, okay? Okay, so far there are no wheezing or crackling sound or any advantageous breath sound, which is good. So if there is any other advantageous breath sound, we are going to take note of it because it may indicate abnormalities. So the next thing we're going to check here is for the anterior voice check. So here we're going to check the bronchophony. So I'm going to tell my patient to say 99 as I'm going to check or auscultate his chest. Okay, Sir Bernie, can you please say 99 for me?
99.
And okay.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Okay, so as I am checking here or auscultate here, so I have heard a muffled and indistinct sound, so which is a good finding. So if we can see an increase of intensity and clarity of spoken voice as I auscultate, it may indicate abnormality. So next thing we're going to inspect here is for the egophony. So here, I'm going to ask my patient to say long E sound. Can you please say long E sound?
E.
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 Okay, so I'm going to check it here. So,
E. E. E, 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 E.
Okay, so as I'm assessing here or auscultate, so I've heard a muffled and long E sound. So the abnormal indication for this, if our patient has can say, if our patient would say long E sound, and if it is sounds like an A, then it is an abnormal indication. So the next thing we're going to check here is for the whispered pectoral key. So here we are going to ask our patient to whisper 99 as I'm going to hear the sound. Can you please whisper 99 for me? Okay. Okay, so I'm going to start to auscultate. Okay, so as my patient whisper 99 word, I heard a fainty and indistinctive sound, which is a normal finding. So if we can hear we can describe unusual clear transmission of whispered sound, we are going to take note of them because it may indicate abnormalities. So if there are abnormalities that indicates on our patient on voice check, we are going to take note of them because it may indicate pulmonary consolidation. So the next thing we're going to do, if our patient is having a cough, we are going to take note of them, take note of their cough as well as their sputum. So in my case of my patient, he has no cough as of now. So the next thing we're going to do is to do hand washing. So, and after we we are going to document all the findings of our patient. So thank you, sir.
Thank you.
So you can put on your shirt. Okay, so that's all for today, and thank you.